Testing, testing. Good morning, everyone. Um, Thank you for attending the Best Practices Conference. My name is Leon Roberts. I am the Dental Support Center Director, and I was grateful to meet Miss Sonia Dunbar earlier this year at a conference I was attending. And Sonia is, she's a dental hygienist, which I am as well. Sonia has over 30 years of experience in dentistry. She's also a public speaker. She's done a TED Talk. She also has co-founded, it was the teledentistry. Let me pull up my phone again. I had this memorized, try to memorize it, y'all. But let's see here. Oh, so she is the co-founder of the National Mobile and Teledentistry Dental Conference, as well as the American Mobile and Dentistry Teledentistry Alliance. So Sonia also is an author. She has written a couple of books, or actually a few books, with one of those being The Tooth and Nothing But the Truth. So we're gonna get some of that today, y'all. We're gonna get some of that tooth truth. Okay, and so also Sonia has been awarded the Phillips Heart to Hand recipient in 2020. Also this year, 2022, she won the Sunstar Award for Distinction. And so without further ado, oh, also one quick note, I just saw this. I was like, wow. So Sonia also has a day. The National Day Archives LLC has proclaimed November the 9th of each calendar year as the Geriatric Tooth Fairy Day. So y'all got somebody that got a day, y'all. All right, so I'm really thankful to have Sonia come here because as my new role, one thing that I've noticed is that there hasn't been a lot of talk about oral health. And a lot of the conferences that I've been in Indian country. And so I wanted to bring Sonia here to talk just a little bit about dentistry, about the correlation between the mouth and the body, because the mouth is the gateway to the body. And so Sonia is going to educate us all. And if you have any questions, there'll be time at the end, and she'll have her contact information. And so without further ado, I would like to introduce Miss Sonia Dunbar.
Yes. Thank you all. Thank you all for being here. I'm so excited to be here. Thank you, Leon, for the warm welcome. And with all of that, he said, the most important thing is my handsome husband, Gerald Dunbar, who's here with me. I'm happy to have him, and that I'm a United States Navy veteran. I'm proud to be to have served our country. So out of all of my accolades and everything that he read, the most important thing to me are two of those two things: that I'm served our country and I have such an amazing husband. And like Leon said, I am a dental hygienist, and I'm so excited to be here presenting to you all today in person and virtual. And what we're going to do is talk about the mouth. We're going to talk about the mouth. The mouth is the biggest part of our body where bacteria and things can get it into our system. There's only so many openings in our body where things can get in. You have your eyes, your ears, your private, but the biggest part is your mouth. That's the biggest opening in your body where bacteria, inflammation, and everything could get in your system is the mouth. So today, we're going to talk about the mouth. Now, studies have shown that there are over 20 billion bacteria that actually live in the mouth. 20 billion. Some of them are good, but some of them are bad. So what we're going to do today is talk about some of those bad bacteria that actually live in the mouth. And I'm going to put my phone, the mic down, and I'll talk about that just a little bit, because I'm going to demonstrate something. A lot of those bacteria that live in our mouth, they form in our mouth, and they're under our teeth. When we eat our food, if we don't floss, if we don't go to the dentist, those bacteria just go in our mouth. They're just moving around. They're alive. They're not dead. They're around our teeth, and they're under our tongue. A lot of bacteria live on our tongue. You know, a lot of us don't brush our tongue. And those bacteria in our mouth. And if we do not deal with those bacteria, take care of that in our mouth, once they grow, they go and they get into our blood system. And once they're in our blood system, Our blood system, that's where the problem comes in it. Just like that balloon went everywhere, that's what those bacteria do in our body. So let's talk about it. You brush your teeth, you have plaque and debris on your teeth, which I'm gonna talk about that and explain what that is. When you brush your teeth, if there's any bleeding, that bacteria gets into your system and it goes throughout your whole body, that bacteria. Once that bacteria is in your system, it's floating around, but your body recognizes that as a strange entity in there. It's like, oh, this shouldn't be here. This is something that shouldn't be here. So your body attacks it. It attacks the bacteria. The bacteria is the yellow part. So your body just does what it does. It goes, that's the green part. It goes and it attacks it. And it's chronically attacking that. That's when you get chronic inflammation. I'm going to be talking about that chronic inflammation because that is important for us to understand that. So you have bacteria in your mouth, all of those bugs I showed you. You brush your teeth, it gets into your blood system, and your body does what it's made to do. It attacks it. And that's where we have a situation. So let's talk about the mouth. Let's talk about gum disease. So just FYI, I'm sure we all know this. We're going to talk about plaque. Plaque is the white, milky stuff that forms on our teeth. You know, even when you brush your teeth, plaque is there. I remember when I was a little girl, we used to scratch our teeth and the yellow stuff would come off. Kids call it cheese or butter, but that's plaque. Soon as you brush your teeth, plaque starts back developing. Plaque is normal. But what happens is, if you don't brush and floss your teeth properly, that plaque become hard. Once that plaque is hard, it's tartar. So that's the difference between plaque and tartar. Tartar is just hard plaque. Now, you can remove plaque with your toothbrush, but once the plaque is hard, you can't remove tartar. Tartar has to be removed by a dental professional. And I like that because that gives me job security. So if everybody removing their tartar, I don't have good job security. So here are the stages of gum disease. You have healthy gums. And this is where the bone is nice and long there. Then let me see if I can get this red dot to work. Let me see. I'm gonna mess nothing up. Oh, there, I messed it up. I messed it up. See, that's why I get to try to do stuff. Let me see. Well, let's just leave it like that. Okay, I'm gonna leave it like that because I messed it up. I don't know what I did. Let's see if I can get it to go back. Oh, I went okay. Oh, I got it to go. Oh, I messed it up. Okay, let me go back. 1, 2, 3. All right, here we go. I'm not going to try to red dot. Okay. So the stage 2, gingivitis, that's when you just have plaque on your teeth. The bone is still long and healthy. But when the tartar gets there, if you can see right on stage 3, the bone is being eaten away because tartar, the bacteria that live on tartar eat away at your bone. Bone is the strongest part, the strongest substance in our body. So if this tartar is strong enough to eat away at your bone, imagine what it's doing to the rest of your body. So stage 4 is when the tartar is coming to a disease, and it's called periodontal disease. A lot of the bone is gone and your teeth are loose and they can fall out. So the plaque is normal, but once you let that plaque stay, it becomes hard and it's tartar. And that's when we have a situation. So the stages: normal gums, pink, firm, and healthy, no bleeding when you brush, that's good. Gingivitis, the plaque is still there. You have a little swelling in between. You see the arrows pointed there. Moderate, you have some gum disease. You have more swollen. And here you have severe periodontal disease, and that's you're losing your teeth at that point. You have a horrible breath odor, and it can be making you sick. And this is when you're brushing your teeth and those bacteria are getting into your blood system, and you have that chronic inflammation entering your blood system, causing you to become sick. The CDC said a few years ago that 47% of Americans 30 or older have some form of gum disease. And this form of gum disease is higher in men than in women. It's higher in poverty and in people with less than a high school education. So underserved people have a higher incidence of gum disease just because they just don't go to the dentist like everyone else, and some of them don't have the insurance of access to care. So this is why it's important to understand that. So let's talk about this. Periodontal disease, that last stage, it is chronic inflammation. That bacteria that's in your mouth gets, because of gum disease, when you brush your teeth, it gets into your blood system and it gives you a chronic inflammation state in your body. So imagine you're always fighting somebody. You'll get tired. And this is what's going on in our mouths. Our mouths is always fighting this bacteria off. And that's where the inflammation comes in. Because our body is going to do what it's supposed to do. But while it's always fighting, it adds to sicknesses. And that's what we're going to talk about, some of those sicknesses. But before we jump into that, this is not normal. If someone brushes their teeth and your toothbrush is pink, or when you spit the toothpaste out, you see pink in the sink, it's not normal. Let me ask you a question. Is this normal to you? So if you cut your hand and your hand bleed, will you go to the doctor? If it's bleeding bad. So why when people brush their teeth and their teeth bleed, they don't go to the dentist? Does that make sense? Bleeding is not normal. And the average palm of your hand is about the size of your mouth. So if your hand bleeds and it's cut bad and it's bleeding, why when you go, because infection can get in there. That's why you're going to go to the doctor if it's deep. So the same with your mouth. And this is why Leon brought this here, because so many people overlook their mouth, and the mouth is critical to our body. We speak with our mouth. We breathe with our mouth. We eat. My favorite thing, we eat with our mouth. It's so important. We need our mouth. Well, this is my favorite thing. We kiss with our mouth. We feel sensation with our mouth. And the mouth is important. It's key. So we need our mouth. And like I said, it's the biggest part of our body where anything can get in. So let's talk about this. The main thing we're talking about today is inflammation and the diseases connected with inflammation in the mouth. And this is why we call this the ABCs of poor oral care, because believe it or not, there are a lot of diseases connected to the mouth and our overall health. So let's get into it. A. Now, I'm going to say this name kind of different. So if I say it wrong, please correct me. Alzheimer's. How do you all say it? Say it one more time. Alzheimer's. Okay, I just say it different sometimes. Now, this is a disease. We're going to start with the letter A. That studies have shown at Johns Hopkins that's directly connected to poor oral health. It's a disease where the brain actually, Alzheimer's is actually a disease that affects our brain, our memory, and our cognitive skills. But as you can see that word plaque there, plaque that's in our mouth in gum disease can be transferred to our brain and actually cause this horrible disease. The bacteria called is P. gingivitis, and it's actually found in the plaque in gum disease. So think about it like this. You know how close your mouth is to your brain. If someone has gum disease, this P. gingivalis, which has been found as a key indicator to Alzheimer's, is in the plaque in your mouth. You brush your teeth, this gets into your blood system and goes to your brain. A. This is why it's so important that we keep this plaque and we keep our mouths healthy, because once the gum disease gets advanced and it goes into your system, it causes inflammation, and that causes different diseases. Like I said, the key name is one of the key bacteria in plaque is P. gingivalis. And one of the key modes of transportation is through inflammation that escapes into the blood system. No one wants this disease. And as studies have shown, it's been people younger and younger are starting to show this disease, and even in their 40s. So it's just not, this disease is just not for older people. It's not just solely an age-related disease. So it's important that we take care of our mouths. I don't know what just happened here. Okay. And this is just, people with gum disease have a quicker decline with this disease. And like I said, it's associated with body inflammation. And this is a study that was done. There's been many studies done on corpses where people who died from this disease, and they found this P. gingivalis bacteria throughout their brain. Let's talk about B, blood pressure. People with gum disease may be twice as likely to have increased blood pressure. B, blood pressure. Here was a study done where it was 250 people who had advanced gum disease and 250 people did not. These people both showed a higher increase in their systolic and their diastolic blood pressure. So gum disease is directly related to high blood pressure. C. Now, this is one that no one wants to look at, is cancer, an oral cancer. There are many types of oral cancer. There's gum cancer, lip cancer, tongue cancer, mouth cancer, throat cancer, cheek cancer, floor to mouth cancer. Cancer can be throughout the whole mouth. One fact about oral cancer is that gum disease and periodontal disease have been, if you have that gum disease or periodontal disease, it can make your cancer advance quicker. And it's also 14 to 20% of people who have oral cancer have been found to have an increase of bacteria in their mouth. And this is the sad thing about oral cancer. Let me ask y'all this. How many have gone to the dentist and the dentist said, let me do an oral cancer screening on you? But oftentimes people go to the dentist and the dentist don't ask that. And because I've worked in many dental offices and they did not, because we were rushing, they wanted their schedules so tight. They mostly get the hygienist maybe 45 minutes for an exam and the cleaning and everything. So we don't have time to take your blood pressure or do oral cancer screening. They want us to get you in and get you out because the money is made by production. So if the dentist is not doing the oral cancer screening, when you go to your medical doctors, how many times does your medical doctor say, well, let me look in your mouth and do an oral cancer screening? No. So if the dentist is not doing the oral cancer screening and the medical doctor is not doing the oral cancer screening, who's doing it? And oral cancer often sometimes, like this is an oral cancer, but it looks like a canker sore, or it's a white patch and it looks like, you may have bit your jaw. So it's also, oral cancer is difficult to identify sometimes. And this particular subject is near and dear to me because like I said, I've been a hygienist for 30 years. And when I first started out, maybe I had been a hygienist maybe 5 years. My uncle moved in with me from Michigan to help me out, my family. And he had a toothache in the back of his mouth. And he thought it was his wisdom tooth. He was like, my wisdom tooth needed to come out, so I'm being a new hygienist. He went to my dental office. They took his wisdom tooth out. He was still having a lot of pain in the back of his mouth. Well, my uncle at 53 died from oral cancer. It wasn't his wisdom tooth. It was cancer. But the dentist never did an oral cancer screening. They just automatically figured the pain in the back of his mouth was his wisdom tooth. And when they took it out, it made the cancer spread. And at 53, he died. It went from the back of his mouth to his throat, and it killed him. So my husband and I, we own a mobile dental practice where we provide dental care for seniors in long-term care facilities. But we also have a nonprofit where we go in the community and we do oral cancer screenings at least twice a month on seniors in the community, because it's higher as people get to age over 65. Yes, sir. Yes, you can do a visual screening where you actually palpitate the glands in the throat around the ears, and you can take a gauze and move the mouth and tongue around. A trained dental professional know what to look for, but we have partnered with a company where we actually have a light that we put the light in the Velscope. We put the light in the mouth, and if there's any cancer, it shows up black. And we actually set up tents outside of senior doctor offices and nursing homes and senior communities. And we do as many as we can. We partner with Crescent Oral B and Dr. Berlin, and we do as many as we can. And then we've actually found some suspicious cases. As a hygienist, I cannot diagnose, but I know when it shows up black, it's something there. So we've actually found a couple of cases. One man, we'll say the questions for the end because I'll sidebar and I want to get through some great information for you all. But one man, I'm going to say this. I started to put his slide in here, but it was too gory. He was maybe 67 years old. At the top of his mouth, it was a hole, bigger than a quarter. And we were at the doctor's office in the parking lot. I had a tent set up. And when I did, you try not to show your face, but everything showed on my face. I looked at the top of the mouth and I was like, what the, and I looked again. So I had to, watch my face, because when you're doing that, people looking at your face. You know, kind of like if you're a woman who's had a baby, when they doing your ultrasound, you looking at their face like, my baby okay? You know what I'm saying? Because you can't see them. So I told the guy, I said, let me talk to you inside. I took him inside and I asked him about the hole. I said, do you know it's a hole in the top of your mouth? He said, yeah, my food come through there sometimes. I said, has your doctor ever seen it? He's like, no. We immediately referred him to the hospital and he got it taken care of. Another lady happened. She had it in the back of her tongue. Listen to this. She came to get the oral cancer screening so she can get something free. Because to get people over there, I give them free products and stuff. So when she came over, she said, well, I have dentures. I don't need an oral cancer screening. I said, oral cancer is not related to your teeth. It goes with your mouth. If you have a mouth, you need a screening. Well, she ended up having it on the back of her tongue. I got her to take out her dentures. It was cancer on the back of her tongue. She said, no one had ever looked at my mouth because I have dentures. So oral cancer is big and it kills. And it's one of the number one, it's one of the number, it was number 4 in as far as cancer. It's moved up to number 3 and it surpassed breast cancer as a killer in the United States, oral cancer. So that's some serious movement. So anyone here that's listening, when you go to your dentist and your medical doctor, ask them to give you an oral cancer screening, because you don't know how to do it if you're not a dental professional to check yourself out. Now, moving along with the ABCs, let's talk about diabetes. D is diabetes. Let's talk about diabetes. This joker been trying to catch me for a long time. I keep running from it because my family has a history of diabetes, but I'm just watching everything I eat and drink and exercise and everything like that, because this is something that you don't want to have. Almost 25% of Americans with diabetes over age of 50 lose all their teeth. So the question about diabetes is, which come first? Diabetes or gum disease, the chicken or the egg? Some people say that, and it's still, science is still doing the study. Can gum disease cause diabetes? Or after you have diabetes, does it make your gum disease worse? But either or, I don't want either one. But if I had the choice between the chicken and the egg, I kind of like that little bird. It's cute. As long as it stays that size. But once they get big, rusty chickens, they be scary looking. You know what I'm saying? But the little chick is cute. The little chick is cute right now. Y'all know that chick is cute. But like I said, science is still going back and forth. Does diabetes cause gum disease, or just once you have diabetes, does it make your gums worse? But either or, it's bad, and it's both effective. So there's a two-way street between gum disease and diabetes. So let me just say it like this. If someone has diabetes, one of the problems with diabetes is that people have a hard time healing when they're diabetic. You don't heal well. You get a wound, you don't heal. So if you have tartar underneath your gums, so your gums are always inflamed and infected, and you're diabetic, it's not going to heal. You're going to always have inflammation. So most people that are diabetic, they end up losing their teeth, because if they don't have their gums, if they don't have immaculate home care, if they don't keep their teeth clean, keep that tartar off, keep that bacteria from under the gums, it just advances, they end up losing their teeth. And I see it all the time. And you don't have to lose your teeth. So here's a cycle. A person with diabetes, they have uncontrolled sugar. Their sugar is uncontrolled. Their pancreas is not producing the right amount of the insulin level is not right in that area. So you have uncontrolled bacteria in your mouth, and your spit is sweet. So the bacteria grow, and bacteria grow more and more in the diabetic mouth because their sugar is uncontrolled. When those bacteria grow, it produces inflammation. That bacteria gets into the bloodstream, and hence the cycle goes around and around. The cycle of inflammation never stops. So a diabetic is always in chronic inflammation. They're always fighting. Their body is always fighting off inflammation. They're always fighting off bacteria. So a diabetic, they have a hard time. So it's important that they have immaculate home care. And I've seen on the schedule with this program that some people are going to be talking about that. So it's important to listen if you go to that course to see if they talk about the mouth. My dad is a diabetic, and when he went to the doctor, I asked him, Dad, did they tell you to go to the dentist? He said no. That's the first thing a medical doctor should tell a diabetic. They tell them to get their eyes checked, and they tell them about their feet, because anything that they get, if those toenails get ingrown, they get a bad foot sore, it's not going to heal good. The circulation is not good with diabetes. If their eyes are not bad, if they're diabetic, if the sugar is bad, they have a high chance of going blind. My grandmother started me on this journey because she was a diabetic. She ended up getting congestive heart failure, losing her leg. I promised her I would never put her in a nursing home, but I couldn't keep her at home. She was too overweight. She had too many problems. And I had to put her in a nursing home. And that's what started my journey doing mobile dentistry, because I seen how neglected their mouths was in nursing homes. So that's what started my journey. But back to the diabetes and the periodontal disease, it's a vicious cycle for them. It goes around and around. So it's imperative that people that are diabetic have good oral care. H, let's talk about that heart. We need our heart. That's just important. That's just as important as our brain. We need everything, but this heart needs to be healthy. Let's talk about the heart. Up to 50% of heart attacks are triggered by oral infection. Is that wild? Up to 50% starts with the mouth. And as you can look at this picture, you can see the bacteria that I explained to you earlier, the bacteria in gum disease and the plaque and tartar. All of that bacteria can leave from, once you brush your teeth, if you get a little blood, it enters the bloodstream. It's always looking for a way to get in. It's just always a battle. It's always internal battles going on in our body. So those bacteria, that's their job. They want to get in there. They get into those blood vessels that go into our heart, and it causes problems. Those deposits, they break loose. Untreated, these deposits can they can get into our narrow arteries, and they clog it. They clog our arteries, and they cause heart attacks and strokes. So the plaque that's under our gums, when they escape, I call them escape artists, they get out and they get in our system, they go right for that heart, because it's always pumping. So it causes inflammation in the heart vessels. And it causes infection in the heart. And if someone has artificial valves, it's even worse, because those get infected. So anybody with a heart problem has to have immaculate oral care. I was just on the phone today with our mobile dental company, because the team is in the field, and one of the nursing homes called, and they said the son, he was like, my mom needs 6 teeth pulled because she needs to get a surgery. And doctors are recognizing that if there's infection in the mouth and she has to get a surgery, whether it's an artificial knee or a hip, they're not going to do it, because the infection is always being perpetuated throughout the body. So they need these teeth out of her mouth. They realize that those teeth are infected. She has advanced periodontal disease. So they're not going to operate on her, because she's not going to get good wound healing, because her body is already fighting. This is a quote that the one doctor said, that the bacteria that live in your mouth when you have gum disease can cross into your blood system, enter into your heart, and directly affect the vulnerable heart valves. She says this is especially concerning in our patients who have artificial heart valves. So the doctors already know that bacteria just crossed over. And I'm actually thinking about it. I had a couple of major surgeries, and not one time did my doctor ask me, did I have gum disease? They never asked me, did I go to the dentist? And I think that's something every doctor should ask people when they get ready to get a procedure done. What's the status of your oral care? Let's talk about this young lady, 37 years old. She had 2 heart attacks, a mother of 2 beautiful small children, and have a happy home and a husband. She had 2 heart attacks at 37. It made the news because no one knew why. She was a runner, very active in her community, fit, not overweight, eat well, just a picture of health. No one knew why she was having these heart attacks. So they started running all these panels on her. This is a picture of her. I just think she's the cutest lady. Her little kids, her husband. I just wanted to show that because she's a cute lady. Nice lady. They was running all these tests on her, and this red is infection and inflammation. They was like, why is it so much inflammation in your body? What's going on? So they started asking her all these questions, and they said, well, one of the nurses said, well, you have a toothache? She said, yeah, I have a tooth that's been hurting me for a while. Come to find out, the tooth was inflamed, it was infected. She needed a root canal. They did a root canal on her, and that number went away. Infection, inflammation. A lot starts with our mouth. See, a lot of people disconnect the mouth from the body, but you can't. The mouth is connected to the body. We can't disconnect that. We got to have the whole mouth body connection. P. We're going to jump around with these alphabets a little bit because a little time. Let's talk about pancreatic cancer. I wanted to talk about this one because it's one that is hard to detect. And once you detect it, it's often really late. But studies have shown bacteria in pancreatic cancer has been linked to the mouth. Now that's a lot. It has been linked to the mouth. Go, but here I go again with my fat fingers. Okay, here we go. So pancreatic cancer and gum disease. So over here, this blue picture, here are the risk morbidities. Over age 55, African-American or Jewish, long-term history of diabetes, gum disease or tooth loss, and acute pancreatitis. I can't say that word right. Pancreatitis. So if you have any of those, that make you at higher risk of developing pancreatic cancer. And this was really a idea for me to look at because one, I'm not yet 55, but I'm running close to it. I'm 53. I am African-American, just in case nobody didn't notice that. My family have a history of diabetes. I don't have any gum disease. And I never had pancreatitis. That's it, pancreatitis. I've never had that. But I watch that because you want to be aware of the risk factors. So there's some risk factors with that. No, they don't really exactly know what actually causes pancreatic cancer, but people who have had these situations in their life have a higher chance of developing pancreatic cancer. So this is a cancer that is very aggressive, and it takes people out of here. So 75% of people more likely to develop pancreatic cancer if they had periodontal disease. 75% of people more likely to develop pancreatic cancer if they have gum disease. That's a high number. And at the bottom, the reason isn't known for sure, but it's thought that certain bacteria that live in the mouth make an enzyme that cause mutants in one type of the gene that leads to pancreatic cancer. So that's some serious stuff. 75% of people, that's a lot. So I wanted to put that on there because that pancreatic cancer, that's no one wants any form of cancer. Let's talk about the cute little babies. I like babies. Let's talk about another P. P is for pregnancy. P is for pregnancy. And LBW is low birth rate and PTW is preterm birth. So this has been around for a long time. That gum disease can cause problems with pregnant women in their delivery. So, and it all relates back to inflammation. Recently, periodontal disease was known as a risk factor for preterm birth or low birth rate. And it's because the bacteria crosses the placenta. Look at the little baby down there upside down. I think the babies are so cute. So let's look at this. Over with the brown pictures, placenta, prenatal inflammation and reduces the growth of the baby. So that has low birth weight. And on the bottom one down there is that the gum disease and inflammation bacteria could cross the placenta and cause preterm birth. So it's been proven that gum disease has an effect on the little babies being born and has an effect on them being born with a low birth rate. So it's important that we take care of our mouth even in pregnancy. And it's something called pregnancy gingivitis. That's kind of normal when your hormones are off balance. But if someone gets pregnant and then they have, if they get pregnant and they already have gum disease, it gives you a chance to have a low birth rate and your baby can be born premature. S, stroke. Yep, patients with gum disease were twice as likely to have a stroke caused by hardening of large arteries within the brain, more likely than those without gum disease. So stroke, S, stroke. And here it is again, that bacteria leaving from under the gums, getting into the blood system, causing inflammation, and it goes into the brain and it causes stroke. It causes large artery strokes. 3 times it causes, it's more Is people who develop these type of strokes are 3 times more likely to have back of the brain strokes, which involves the vision and coordination and bodily functions. So that's the back of the brain stroke. And then it's also is known to target large blood cells, which causes also blockers in the back of the brain, back of the skull as well. So these are the different type of strokes that people have with gum disease. And it's all the bottom one says inflammation. It all has something to do with inflammation in the gums. R, rheumatoid arthritis. 65% of people with rheumatoid arthritis has some form of gum disease. Studies have linked the bacteria involved in rheumatoid arthritis to gum disease. I guess you guys didn't notice so many diseases were connected to the mouth. It's a lot of them, but we're not gonna go through them all, so don't worry. We're gonna hit the high level ones. And like I said, this is a Johns Hopkins study, and you can see the word inflammation in there. I always make sure I got the word inflammation in there because that's what it is. The Johns Hopkins study showed how inflammation that's involved in rheumatoid arthritis was also found in gum disease. The bacteria. And rheumatoid arthritis affects 1.5 million people a year in America. And it's just chronic inflammation. That's here again, we're saying chronic inflammation again. Chronic inflammation, right? When we first started out, that bacteria gets in the blood system. Your body begins to fight it. It's doing what it normally does. It's fighting off the bacteria, and it causes chronic inflammation. And all that chronic inflammation causes all these diseases. So let's go through some of the ABCs we discussed today. Somebody say that word. There you go. There you go. It just don't want to come out my mouth right. Blood pressure, cancer, diabetes, eating disorders, funguses in the mouth, gum disease, heart attack, jaw pain, kidney disease, leukoplakia, that's the white stuff that comes in our mouth, malodor, osteoporosis, and another big one with gum disease. And it just makes sense because of gum disease eats away at the bone that's underneath our gums. It just makes sense for it to mess with, to have osteoporosis. Pneumonia, that's a huge one. Pneumonia is really big, and I'm going to tell you why, especially during this COVID time. If someone has gum disease and the plaque and the bacteria is in your mouth, especially older people, because I work in nursing homes. Imagine an older person sitting in a wheelchair all day. They don't walk around, they don't open and close their lungs like we do. And they have all this bacteria in their mouth because they're not cleaning their teeth. They're going to inhale that bacteria. It gets in their lungs, and they call that aspiration pneumonia. And that kills a lot of people. Now imagine someone with plaque and bacteria all in their mouth, not able to brush their teeth, don't have good oral care. They develop COVID. They breathe in this bacteria in. How can they heal? So it's no wonder why so many of our people in long-term care facilities suffered so disproportionately with the COVID virus, because a lot of them do not have they don't have the dexterity, or they don't remember to brush their teeth. Older people just suffer. So they're dependent on someone else to take care of their mouth. So before COVID, aspiration pneumonia was the #1 reason people went to the hospital in long-term care facilities. So this is a big one for older adults. If they don't have great oral care, if they develop COVID, or if they don't develop COVID, if they don't have good oral care, they breathe in that bacteria, it gets in their lungs, and that can cause pneumonia. That's a big one. That takes a lot of people out of here. And once they get in the hospital, it just escalates. Respiratory infection, which makes sense. RA, respiratory infection, and rheumatoid arthritis, that's the R. Stomatitis. That's big, because what stomatitis is when people have dentures and they're not removing their dentures, their gums overgrow. So that's really painful. And once those gums overgrow, it becomes hard, and you have to kind of cut that off. No one wants their gums cut. That doesn't feel good. Tooth decay, ulceration, how do you say that? Ulcerative gingivitis. Yeah, I always say that wrong. Xerostomia, which is extremely dry mouth. and no Y and no Z. But those are the ABCs of poor oral care. So I wouldn't be the tooth fairy if I didn't give you a tooth fairy tip. And like I said, I call myself the geriatric tooth fairy because I work in nursing homes. I take care of the older people mouth. My husband and I, we have a mobile dental company. We go to different nursing homes in different states, and we provide comprehensive dental care in long-term care facilities. We pop up. We make a whole dental office wherever they give us space, and we take care of their teeth. We do dentures, partials, fillings, extractions. We do everything. And then we also train the staff on how to take care of people. Hence the name, the geriatric tooth fairy. I like to educate people on what's going on in long-term care facilities. I like to educate people on the importance of taking care of our mouth as we age and throughout our life. So let's talk about this tongue. How many people here brush their tongue? That's not good. You should not brush your tongue. You shouldn't. Because I'm going to tell you, when you brush your tongue is like, it has all these little hairs on it. So when you brush your tongue, you're just brushing the bacteria around like a soup bowl. It's not coming out. You're just brushing a little hair follicles, food, bacteria. You're just brushing it around and around. So just imagine me just stirring all that up and making a big gumbo, right? So you should scrape your tongue. This is a tongue cleaner. Yeah, you should scrape your tongue. And I'm going to tell you, if you scrape your tongue, you'll see that white stuff come off your tongue. And you're going to be like, ugh, yeah, she said that. But you shouldn't, because when you brush your tongue, you're not removing the bacteria. You're just brushing it around. So you should use a tongue cleaner. That's what we should do. So I have a couple of these I want to give away. I love this brush. I love this company because this guy, he's not even a dentist. He invented this, so he's an engineer. And he said a lot of people are not really cleaning their tongue, and tongue scrapers are hard to find. Because I went looking for them at CVS. You got to kind of look, and you can't buy just one. You got to buy a pack or something, So I like this guy because he made this. The brushes are made out of the charcoal bristles, and it's got a little tongue cleaner on the bottom of it. And I think it's a cool thing. And it has even a little kickstand you can sit it on when you finish. So I travel with mine, and you can keep it cleaner. You can disinfect it and just put your little cap over it. You should always cap your toothbrush. Don't let the bacteria, when people flush their toilet, get all on your brush in the bathroom. You know what I'm saying? You should just kind of cover up the toothbrush. Even if you got to put a garbage bag over a little sandwich bag, just cover it up. Just don't let the toothbrush breathe like that. That's kind of nasty. Cover up the toothbrush, please. But I like the tongue scraper. So I'm going to give a couple of these away. But if you would like to, this company, and it helps get rid of some of those bacteria, because here's the thing. And my husband and I noticed this a couple of years ago, when we developed the flu. It took us a long time to get over it. We had the flu for like 2 weeks. No, people don't have it that long. But my husband said, baby, we keep brushing our teeth with the same toothbrush. Let's change our brush. So we went and we bought a whole bunch of disposable brushes. And once we started changing our brush every time, it went away. So we tell people in the nursing home, if someone gets sick, especially if they have an electric brush, put the brush down, get them a whole bunch of cheap brushes, and every day have them to brush their teeth with a different brush. If they have dentures, clean the dentures and clean out the cup. But if you get sick, change your toothbrush every day. Don't use the same brush because you're just going to keep reinfecting yourself. Even if you rinse your brush, there are bacteria living in the bristles. So it just makes sense. If you get a cold, if you get COVID, this is just a nugget from the tooth fairy. Get a different brush and use it. But also, let me ask you this. You take a shower. How many people take a shower and put on the same dirty clothes? That's the same thing of brushing your teeth and not cleaning your tongue. If your teeth are nice and clean, but that tongue dirty, it's still wrapping around your teeth. Doesn't make sense. So you have to clean your tongue and not just stir the bacteria around, but get it off. Scrape it off. You don't have to scrape hard till you bleed. Just scrape, rinse, scrape, rinse. So I like this. It's called let me see, put it on this. And it sits up like that. Y'all can't see it online, so you should be here. If you're online, you can't see it, but it's a cute little brush. It kind of stands up on its own little kickstand. But I like this. But I've got 2 of these to give away. The company gave me 2. It has a little thing in the back. So it shouldn't be hard because there's only a few of us in here. So 2 people going to win something today. So, but this is the name of the company. This is the company. And here is their website, tiki.com. And you can order this brush. I'm going to go back. and the kickstand and a little travel bag. You can order it, and I like it. You can order that, and if you use my code, the Jerry X 2 for 10, they'll give you some off on that. But it's a great brush, and I think and once you order it, they'll put you like on a thing, and you can get another one like every 3 months. Now, personally, I met people who change their toothbrush every time they go to the dentist every 6 months. Would you change your towel that you wash up with every 6 months? I hope not. So I kind of change my toothbrush every month. I know that's a bit, people haven't heard that, but I don't keep my toothbrush like that because it just needs to be changed. It needs to be, you cannot clean your toothbrush like you should just pushing it up under water. So you should change your toothbrush more than every 3 to 6 months. You should change it more often because because you've learned today, there's a lot of bacteria that actually live in the mouth. So the question that I want to ask everyone that's here in the room, Guy, you see people online, they can answer the question, but they can't. I guess I can mail them a toothbrush. People here, should I let the people online be involved in the contest? Yes or no? It's up to y'all. But raise your hand for yes and keep it down for no. Okay, everybody's involved. Okay, so now I went through the ABCs of poor oral care. There were 5 alphabets that I didn't list. 1, 2, 3, 6. 6 of them that didn't have a disease connected to it. I'll give everybody a chance to write them down. Whoever names 6 of them wins. If you're online, if you're in the United States, I will mail you a brush. I'm not mailing this brush to you out of the country and paying no $45. It's just not going to happen. So if you're in the United States of America, I will mail you a brush. We mailed our son a bag to Hawaii just for Valentine's Day, and it cost $100. It was just a basket. I started to say, let me tell you what's in it, and you go buy it. But you know, it's a point of opening it up, right? Okay, so how many have all 6 alphabet? Look online. Does anybody have all 6? Put your hand up if you're online. Push the little yellow hand and put it up. Even if your hand's not yellow, push it. I'm thinking Zoom should make different color hands. I'm just saying. It should be a blue hand, a yellow hand, a red hand, a orange hand, different color hands. So people can have a purple hand, whatever they want. There's no hands up online. Does anybody here know the 6 alphabet? Somebody got a hand up, say 6. Okay. You got 4. She got 6. Let me see her. I'm not gonna have to say it out loud because she might not have the right ones. Let me go look. I don't want somebody else to get it. Let me see. I thought you had it. Okay, let me see. Okay, let me see. You're wrong there. You're wrong there. You're wrong there. God bless you.
That's right.
Yeah, baby, that's your heart. Okay, write it clear. Maybe I can't read it. That's give it a chance. Maybe I can't read what you said. Let me get my glasses. How about that? Let me get my glasses. Let me see what my girl have here. Let me see. Don't say that while you writing. Let me see what you have because she has 4. Anybody online have 4? Okay, you got 4. Okay, hold on. Okay, that's right. 1, a 2, a 3. She got 4 of them right. So let me see if your 6 is right. See why I ain't say it out loud? See? You try. Just keep trying. She okay. Oh, you got some? You did some? How many? You have 6? Oh, did she look on your paper? Okay. Oh, you do got a lot of notes. Make me feel like I did something. Okay, so what don't have, which letters don't have? You don't got everything that do have. You think is, no, we said, no, not the ones I didn't talk about, the alphabet that didn't have a disease related to it. Okay, you don't have it? You want to give it a second? Give her a second, okay. So did I mention, right, yeah. But I think, oh, did I say that question wrong? Okay, so while they're doing that, anybody have any questions? Somebody have it online? Let me see. Let me see online. See online. I should have set a timer for this. They got too much time, but I didn't say nothing out loud. Oh, could they go back and look at the slides? No. Okay, let me see what they got. Okay. 1, 2, 3, 4. They got 4. That one's wrong. Tell them they have 4 online. What's the name? Jill, you have 4 of them. Thank you for trying. So we have a lady here to have 4 before you, so I'm gonna have to go with her 4. I'm gonna go with her 4. Anybody have any questions online? Yes, sir, in the room. Call it Velscope. 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 And I can give you that contact information. No, I can give you the contact information that you can call the company and see about getting one if you're interested. Velscope. That's the name of the light. Okay. Young lady, you have any or you want to just pass? You're going to pass. So I think we have a winner in the room and might have a winner online. Yo, what you got? I think I'm gonna keep you with your 4. You winning with your 4. You winning with your 4. So we got 2 people. Jill, and what's your name, ma'am? Waita. So say Lo. Jill and Lo got it. So you guys got the toothbrushes. So Jill, we'd have to ask Jill to inbox you, private chat you. You can say, okay, you get Jill address so USET can mail it to her. Okay. So there we go, my advancer. Any more questions? Anybody online have any questions? If you want this brush, I'm telling you, it's an amazing brush. Let me see, do I have a black one and a white one? I don't know. Here you go, Jill. I don't know. I think this is the black. I think that's the only thing I have left is the black ones. All right. So if anybody doesn't have any questions, this is where you can find me. I have a podcast called Suave and Sassy Seniors with Sonia, where I interview seniors living their best life. Seniors living their best life. Actually, to tune into that is wherever you find your podcast. And I also have a podcast called Dentistry Gone Wild with my good friend, Melissa Turner. And we talk about all types of mobile and teledentistry. So those are my 2 podcasts. These are my 3 books. Golden Nuggets of Life. And that was a book I wrote when I first started out going into nursing homes and the stories that seniors told me. My book is available on Amazon in English and Spanish, but there's stories that people told me because I'm believing that a lot of the stories in long-term care facilities, people take to the grave. And it's some amazing stories in that book. It make you laugh, cry, and smile. It's even on Audible for a little bit of nothing. The Truth and Nothing But the Truth. It talks about the ABCs of poor oral care. And the modern mobile and teledentistry is just how you, if you ever want to start doing your own mobile dental company, you can definitely start that up. Those are my books. That's my TEDx. I ask people, if you have a time, go to Google TEDx, Sonia Dunbar, and listen to my TEDx. It talks about my story with my grandmother and the horrible oral care condition that's going on in long-term care facilities. It's a great TEDx. I did it about 2 years ago, and it's really good. And this is my mobile dental conference. It's going to be in March of 2023. It's going to be in Texas, right outside of Dallas. And it's called Momentum, and it talks about all type of mobile and teledentistry. It's usually about 500 people there. Gets really involved if you know anything. Yes, sir. This is our 4th year doing it. Yep. And that's my QR code. I ask people to please scan that and follow me on Instagram. Please scan that and follow me on Instagram. I have a lot of amazing tips and information going on about mobile and teledentistry on my Instagram account. So please scan that and follow me on Instagram. I really appreciate having an opportunity to present for you all and being a part of this great organization. Thank you.
And thank you, Sonia, for your presentation. And you said we have a little gift bag here for you. And thank you all for attending today. And I think we learned a lot about those ABCs. So it's easier than 1, 2, 3. And we did learn a lot of information. And one thing that I got from it too was when Sonia was talking about how the mouth is fighting all the time. I mean, even in boxing, you have a 3-minute break. It's like 3-minute rounds, 5 minutes in UFC. But your mouth is like, my whole life, I had to fight. So thank you again, Sonia. Also, if there's any questions about any of the materials that she had, any of the dental aids or any of the equipment, as the Dental Support Center Director, what I do is I help the tribal nations procure these dental supplies or equipment. I'm also in the process of purchasing portable dental equipment to help increase access to care throughout Indian country, in the Nashville area specifically, but hopefully we can go across Indian country. So once again, thank you, Sonia. I will be giving a presentation tomorrow. So I'll be talking more about dentistry and the GIPRA numbers. So if you can join. Dental equipment. So thank you all, and enjoy the rest of best practices here at USET. Thank you.